Yellowknife has evacuated, forced out by the wildfires. First responders are helping those who can't leave on their own.
Military aircraft are scheduled for today. We'll continue to focus on helping the most vulnerable, and we'll be there to help for as long as it takes.
Yellowknife's hospital is the center of the territory's acute care system. Moving the patients is a delicate task.
The most important patients are the ones that are the sickest in your intensive care unit.
Dr. Louis Francis-Cuddy treated patients fleeing the Fort McMurray wildfires in 2016. He says moving people safely is a matter of planning, that the new hospital needs to know exactly what they'll need to handle the patients, some of whom require immediate care.
Any upcoming surgeries that are urgent that need to be done have to be passed on to the receiving facility as well.
When the largest fire in Nova Scotia's history forced the evacuation of Roseway Hospital in Shelburne County earlier this year, staff discharged who they could.
Folks that could go home with supports and were ready to go home were supported to go home. Those that we knew absolutely could not go home, we examined their care plans carefully.
Even with planning and multiple meetings a day, they forgot something.
The area that the hospital was in was in a evacuation zone, and we didn't consider how staff and physicians would get their vehicles off the property afterwards.
Those evacuations weren't even half as long as that from Yellowknife. Francis-Cuddy says residents need to be able to sustain themselves for 48 hours. That lessens the burden on hospitals and helps healthcare workers racing against the flames and fighting to think of everything. Nathaniel Dove, Global News.